Are dental crowns bad for your teeth and bad for your health? Let's find out. I think that's called a hook. I'm just old enough to where I'm not privy to any social media or YouTube marketing schemes, but I think that's called a hook, where I ask a crazy question in the beginning and then we go right to the intro thing. So I've been getting a lot of patients this week, this month, in the past couple of months, worried about crowns being bad for your teeth, which is new. The whole root canal thing, that's been a thing for a while, and I'll address that in another video. But recently, and I would have to say the group of dentists I associate, well, first of all, dentists are very weird people. I have a lot of good buddies that are dentists, but I'm not associating with a lot of dentists. And if you ask other dentists, they're saying the same thing. I don't know why we're a weird bunch, but the group I'm from, biomedically trained dentists that practice a biomimetic-like dentistry, have somehow scared the general public into that crowns are bad for you. Crowns are not bad for you. Dental crowns have been around for a very long time. They're getting better every year. Dental crowns are not bad for you. As someone who practices a more conservative biomimetic approach, I'm still telling you crowns are not bad. Ideally, when you do a dental crown, the less you drill on the tooth and the more of your own healthy tooth is under the crown is better. They call them biomimetic overlays, crown lays, onlays. It's all on a spectrum of how much porcelain's on the tooth and how much tooth is under the porcelain. But I want to go into the research on why people think crowns are bad and kind of show you what the science shows. I will tell you, as a practicing dentist, sometimes there's a large disconnect between what is in the science and what actually happens in the real world. This is a common criticism of academia, and I have zero qualms criticizing academia. Although they're all good people with good hearts, and I'm sure they love their families and do good things in the community. If you're behind a microscope or in a lab with a white coat on and don't treat patients, and then produce articles on how to treat patients, it's a huge disconnect. If you're a mother listening to this, this will connect with you. That's like getting advice on how to treat and parent your kids from someone who's not a mother. You know, there's kind of that joke online where before people have kids, they say, I would never let my kid do X, X, and X. Eat junk food, look at an iPad, act this way in public. And then that person has kids and their kids do all of that. So same thing with the science. The science is a guide. It's maybe a scaffold for how to treat patients. And then the clinician, what you need your clinician to do, and what I'm trying to do here is interpret the science for you based off my experience and then help you make better decisions. And I can't be mad at these patients for reading something on TikTok or watching something on Instagram and then coming in and thinking crowns are bad for you. If you're watching the video to this podcast, I'm wearing orange glasses because some neurosurgeon has convinced me that looking at blue artificial light before the sun gets up is bad for your brain. So I am also a victim to listening to things online and following them. But let's go into the research. Okay. One of the biggest things people come to me as a dentist for is they want to avoid the root canal. And I had the same spiel I tell everyone. I say the same thing. I say, people travel very far to see me, and this is true, and I'm not bragging about myself, with the idea I can guarantee to them they will not need a root canal after a procedure. And then the patient's like, oh, wow, that's how great I'm in the right place. But then I follow up and say, I could never give you that guarantee. The human body is wild. Teeth are even crazier. If you work on humans in any capacity, you know that like you'll do a procedure and leave and think to yourself, wow, that was the best procedure I've ever done. I'm probably going to get a Nobel Peace Prize for this. And then the outcomes are terrible. Or you'll do a procedure and go, oh man, I feel like I didn't do well. And then you see that patient 10 years later and it worked out perfect. So there is not a direct correlation between procedure and outcome because there's a variable called the human body. So there's 5 things that people worry about most commonly when they come to my practice. 4 things about getting a crown. First one's always root canal. They're always worried that like when they get a crown, are they going to need a root canal? And we'll go into that. They're worried about, well, what if the crown breaks? What if the crown falls off? That's a legitimate concern. You pay almost $2,000 for a crown. You want to make sure it works. The third thing is, what if I get a cavity on it? Or what if the bacteria in my mouth changes? The fourth thing is, how will it affect my gums? Or a more dental way to say it, how will it affect my periodontal status? Okay, root canals. That's a hot topic. I just got to bring this up now. There's some dentist online that says root canals cause breast cancer. That's 100% false. And I'm not pro root canal. I'm not anti-root canal, but I'm not pro-root canal. I'm not on the root canal board of American dentists. But to say that one root canal is the root cause of oral breast cancer is insane. If you know anything about cancer, and if you listen to my podcast long enough before it was even a dental podcast, I know more about cancer than the general public because of unfortunate family circumstances. I know way more about cancer than most people. I know a lot about cancer. What causes cancer? It's not one root canal. There's a whole other metabolic side of it, circadian rhythm side of it, environmental side, genetic side of it, of cancer. So to say one, and I feel bad for these patients because they truly believe that one root canal causes breast cancer. And I have a patient, wonderful woman, got a root canal, and 3 months later got breast cancer, and is dead set convinced it caused her cancer. Now, I'm not saying that there's not an increased risk, but there's no way one root canal will cause breast cancer. I just have to come out and say that. You got to do first principle thinking. What is causing this cancer? Is it metabolic, sunlight, circadian rhythm? But that's for another podcast. Okay, so if you look at the research and you look at, well, what does the research say about getting a crown and the incidence or complication of needing a root canal after? Based on almost 90,000 crowns, which I shouldn't make this joke, but if you go to a dental corporation, they probably do that a week. Okay, 90,000 crowns. The risk of endodontic treatment, which is root canal placement, is low. And if you further read this study, it's about 10% over a 10-year period. So if you get a dental crown, there's about a 10% chance over the next 10 years you'll need a root canal. Now, I've heard other studies where it's 20% over 10 years, but it's between 10 and 20% that you'll need a root canal on a crown tooth in the 10-year period you get it. Well, it's not just cut and dry. There are factors that affect this. And if you look at another study called the prospective study of the incidence of asymptomatic pulp necrosis following crown preparation, riveting, what increases the chances is if you're under 50 years old, the worse off the condition of the tooth is before the crown is done, and if it's an all ceramic crown. I only do all ceramic crowns, and I have a lower incidence of root canals, and I'll explain later in this video why. So that's why you have to be very careful when you read the research, because you'll read this article and you'll read, okay, I'm under 50, my tooth kind of cracked in half, and now my dentist wants to do an all ceramic crown. I'm for sure going to get a root canal. But I have a technique through biomimetics that reduces the chances of root canals after all ceramic crowns. So you got to be very careful. That's how you have to mix experience with research when you talk about clinical outcomes. So why if you're under 50? Basically, you have a nerve inside your tooth, and the nerve is more sensitive to trauma if the younger you are, and less sensitive to trauma the older you are. So there's a higher chance of root canal when you are under 50. I mean, it makes logical sense. You crack a tooth in half and almost expose the nerve, and then crown the tooth, there's absolutely a much higher chance of needing a root canal than if you just have a small cavity on a tooth with a large silver filling. That would be a lower chance of root canal. So about 10% chance of root canal after a crown. The second thing people are worried about is, what if the crown breaks? And this is such a legitimate concern, not so much from a biological outcome standpoint, but from a money standpoint. I'll just tell you what I do in my practice. 5-year warranty on the crown. Sometimes it's hard to tell how the crown's going to work out, because sometimes you don't really know how the person bites and chews, or in dentistry was called occlusion, how the teeth come together. So I find that most people have a relatively stable occlusion, and you put a crown in, and 10 years later, the crown's still there, not cracked. That's great. I will tell you, I've had a patient that had the hardest bite I've ever seen. I put a crown in 3 p.m. on a Thursday or 1 p.m. on a Thursday, and 2 hours later, he called me and the crown cracked in half. And then I put the crown back in, and a year later, it cracked in half. But I have a 5-year warranty across the board. If anything happens to this crown in 5 years, I cover it. But what does the research say? Because I want people to trust me. But after 5 years, you can only do so much. Like, how much of a warranty do you get on your tires if you buy new tires for your truck and drive off a cliff? They shouldn't be covered. Okay, so the clinical outcomes of full coverage lithium disilicate restorations. Lithium disilicate is what the other article talks about, all ceramic. Basically, 100% of these crowns survived at 2 years. I don't believe that, but I'm sure it's a very, very high percentage of crowns survive after 2 years, meaning no cavity, no cracks. They're still there. They're working good. And at 5 years, 98% survive. So if you have a relatively good dentist that you trust and you're pretty easygoing to work on as well, you have an above 90% chance that if you get a crown, it's still there in perfect condition at the 5-year mark. The second concern or third concern people get is, well, what if I get another cavity under this crown? Is that an increased risk? Yes and no. And at the end, when I talk about a biomimetic technique that reduces the risk of root canal, this biomimetic technique also reduces the risk of what's called recurrent decay or another cavity. So recurrent cavities, basically the percentage is low. If you go to this chart here, within the 5-year period at follow-up is close to 0%, maybe 1, 2, 3, 5% chance of decay. And then it slowly increases after 5 years. I will just say this. I'm always trying to look for the root cause. What's the root cause of the cavity? What's the root cause of needing this crown? What's the root cause of needing any dental treatment? And in my own life, any medical treatment. If you can get a cavity on a natural virgin tooth, or even a cavity on a tooth with a filling, and I put a crown on it, And the thing that caused the cavity on the natural tooth before the crown is still present within your system. Your diet, your mouth breathing, your sleep apnea, your grinding, your brush and flossing. If whatever's still there that caused the cavity on the natural tooth, it's only logically, and a logical outcome would be you could probably still get a cavity on the crown. Just because I crown your tooth, it doesn't make your teeth immune to cavities. And I'm not being judgmental or critical on this, because I have a lot of patients that come to me and say, can't you just crown all my teeth so then I don't have to worry about cavities anymore? I'm sure what's a field of that's not my expertise, basically everything but dentistry. And I have ideas that aren't even close to true. So when a patient comes in and says that, I'm not judging them, but I need to help them understand that if we don't understand the root cause and you get a cavity on this tooth, one, I got to charge you to do it again. And two, your health is declining because cavities on teeth are just symptoms of a larger problem. So the risk of cavity is low, but if you don't fix your lifestyle, there's still a risk of cavity. Something that's interesting, I'll pull this article up on the main screen here. This article was written in 1992, which I was 5 years old. And they found an increase of mutant streptococci in margins of fillings and crowns. I know everyone who listens to my podcast is an avid listener to all the episodes, but I did a podcast on how this lawyer and this lady from California submitted a class action lawsuit saying that Listerine caused all these terrible things. Go watch the video. You'll love it. And one of the things is an increased use of Listerine caused an increase of Streptococcus mutans in the mouth. And if you go to my first video, you know that Streptococcus mutans is one of the bad bacteria that increases the risk of dental cavities and dental disease. And they found that if you evaluate the bacteria around crowns and around fillings, there's actually an increased amount of Streptococcus mutans. So again, the oral microbiome, the oral microbiology is still in its infancy and how it really impacts oral health. But it's something to note that Streptococcus mutans is around fillings and crowns. So if you have a virgin untouched tooth, there's a lower collection of Streptococcus mutans. But if you have a crown on the tooth, there's a higher collection of Streptococcus mutans. But I always talk about this. Correlation, cause, first principles thinking, or even thinking what came first. So when you hear me say this, the first thing you should say to yourself is, did putting the crown on the tooth increase the amount of the bad bacteria around the tooth, or was the bad bacteria already around the tooth, which created an environment to need the crown or to need the filling? So it's very important to consider what causes what. Also, another concern people, and this is a legitimate concern because I see this a lot, is how does the crown affect my gums? Are my gums going to recede? Am I going to get gum disease? It's hard to tell, but I found this study that you are at an increased risk of poor periodontal health outcomes after a crown if you have diabetes. And you're at a decreased risk of poor periodontal health outcomes if you don't have diabetes. So yes, the deeper the crown is under your gum, the more chance you can have a gum issue after placing the crown. But that increases the risk even more if you have periodontal disease. And to connect all this for you, there's a large correlation between insulin resistance and periodontal disease. So diabetic patients, that's insulin resistance, and getting periodontal disease. And there's also an increased risk from insulin resistance and getting cancer, insulin resistance and getting cardiovascular disease, insulin resistance and getting Alzheimer, dementia. So insulin resistance, or what may be called a part of metabolic syndrome, leads to all these other diseases. So if you look back, if you think, well, insulin resistance can cause all these diseases, insulin resistance can increase the risk of gum disease, what causes the insulin resistance? And that will actually help you be healthier with everything. But it's something to look at. So are crowns bad for your gums? No. But if you have insulin resistance, diabetes, there's an increased risk the crown can disrupt your gum tissue. Okay. Now for the grand finale. Now for what I've been holding back. Something that biomimetic dentists do that really all dentists can do. It's nothing super special, but it's just tedious and time consuming and you need the right materials. Is something called immediate dentin sealing. So this article, The Clinical Benefits of Immediate Dentin Sealing, a Systematic Review and Meta-Analysis. Basically, when you drill on a tooth, the tooth has two layers to it. An outer hard shell, which is the enamel, which is made of rods, or think of like sticks. And an inner softer layer, which is dentin, which is composed of tubes. So when you drill on dentin, all of those tubes open wide up. And those tubes are a direct path to the nerve of the tooth, the pulp of the tooth. Bacteria can get in there. Pressure changes in those tubes can cause the nerve to be sensitive. The bacteria that gets in there can cause the nerve to die, can cause infections on the tooth. So if you think about that logically, if you seal those tubes, you have an increased chance of avoiding the root canal, increased chance of the tooth being sensitive. And also, if you further read this, you have an increased chance of the crown not breaking and an increased chance of or a decreased chance of cavities after. So all these concerns of increased risk of root canal, the crown breaking, increased risk of cavity, increased risk of gum disease, all of these can be reduced with a technique called immediate dentin sealing. So are crowns bad for you? No. Are crowns done incorrectly bad for you? Yes. Are crowns done correctly bad for you? No. And I think one of the ways to stack the odds in your favor is to find a dentist who will do immediate dentin sealing on your crown. And it doesn't even have to be a biomimetic dentist. You can look up online how to do this. You can buy the materials how to do this. You can practice it a couple times, and it's a relatively simple procedure, but very technique sensitive. Shoot, ask your dentist to call me or email me if you can't travel to see me, and I will teach your dentist how to do immediate dentin sealing. Because I think if you get a couple of crowns with this procedure done, you would be less nervous about the crown. So the reason why immediate dentin sealing works is because it seals those tubes immediately, the dentin tubes, and then it reduces the chances of some of the negative outcomes. And that's what I do in my practice. So the risk of root canal on an all ceramic crown is higher when you don't have immediate dentin sealing, but the risk of root canal is lower when you have immediate dentin sealing. And that's the truth. So I really appreciate you guys listening to this. I had a patient who's like kind of become like a friend. He's a really cool guy who just texted me and said, I'd listened to your podcast. I love it. The volume's doing great. This patient has actually been listening to the podcast over all my phases. When I talked about the Bible, when I talked about current events, when I interviewed people. And it makes me feel really good when people reach out to me and say they like the podcast. So I practice biomimetic dentistry. I have someone in my practice that practices implant dentistry. He's a general dentist. And his enthusiasm and zeal for the profession is infectious. And I hear him talk to his patients. And when he walks into a room after he gives his spiel, says who he is, he says, I want to let you know, God put me on this earth to fix your smile and to do this procedure. And I feel that way about helping patients discover the truth about their health and the truth about dentistry. I really believe that God has put me on this planet to help you become healthier. Thank you so much for listening. I really appreciate you guys, and I'll talk to you soon. Bye.